Hey guys, welcome to the part 2 of the FAQs on buttock implants. Now, in the last video, we spoke about something very interesting. A question that popped up was whether fat lasts longer or the implant lasts longer. We answered that question and it was quite an interesting one. Again, today we are going to do a few questions that do connect into these things, and let's see what we get for these questions. Combining, okay, so fat transfer and buttock implants. So there are two main types of buttock augmentations. One is through fat transfer, which became very famous as BBL, which is the Brazilian butt lift. We now do a procedure where we don't put fat inside the muscle because it is very dangerous and it's life-threatening even. So we put fat above the muscle in the fat that is there in your buttocks. This is a procedure we use what is called as EVL, and that is how we put the fat over there. The second method is through buttock implants, and I put these personally inside the muscle, which I feel is a much better way to do it. Now, there is a technique where we combine both, where we do fat grafting through EVL and where we do the butt implant inside the muscle, and this is what is called as a hybrid, which is a combination, which means a combination of the two techniques. So it is called as hybrid buttock augmentation. What are the advantages? So one of the main advantages is that the implant gives projection and it gives the required shape and the stability to the buttock, whereas the fat can be used as a medium of one, increasing the volume definitely and covering if any chances of any implant visibility is there. Two, it can help give better shape to the buttocks, and we can put it in areas where the buttock implant can't go because it is inside the muscle. And three, this is especially important in areas such as your hip dips, which is the sides of your hips. A lot of people have flattening in that area, which is called as hip dips. Here, the buttock implants cannot go, and you can put the fat over here. This really helps improve the overall shape of the patient, with not just how the back goes into the buttocks, but on the sides as well. Buttock implants and hourglass figure. Okay, so buttock implants will help improve your shape, your body shape, when you look at yourself from the profile view or the side view, where your back will transgress into your buttocks. However, if you're looking at the hourglass shape, when you're looking at your cavity, when you're standing straight, or from the back when it's going that way, over there, the sides is what you're looking at augmenting. That is not where the buttock implants go. As we said in a previous question, that is where we put the fat into it. So when we want to correct the hip dips, the only solution we have is putting fat into it. There are solid silicone implants that can be put into these areas. However, the issue is that in Indian patients and in patients of color, the scars are really not that good. So we prefer putting fat into the hip dips whenever we want to correct them. So there are a few very funny videos on YouTube. You must have seen a woman who can actually flip her implant, and you can see the underside of the implant that is flat and the upper side that is round, and you can actually make out, and she can do this on her own. This is an extreme example, but sometimes the implants can move inside your buttocks. How we take care that this does not happen is, one, we make a pocket. Pocket is where the implant sits, that is exactly fitting to your implant. So this does not allow your implant to move a lot. Second, I like putting it inside the muscle because this also prevents the implant from moving around a lot, because it's a tight space, and when the muscle contracts, it keeps the implant in place. Third, immediately after the surgery, we give you dressing so that the implant sort of fix into the areas where they are, and that the chances of them moving are relatively quite less. But yes, implants can move after your surgery. Buttock implants needing replacement. It's something that you have to think that implants are basically going to stay the same inside the muscle whenever you age. With age, maybe 10, 15 or even 20 years down the line, you may not need to replace the implant if your shape sort of stays the same. However, if your shape changes, the shape of the buttock implant that you had in your youth might not sort of agree to that shape that you may have 20 years down the line, and you may want to change it. It is only these reasons why we usually change buttock implants. We don't change buttock implants for things like they have a particular amount of life or anything of that sort, just like how we don't change breast implants unless you need to. The chances of changing breast implants are much higher because the gravity acts much more on breast compared to buttocks. However, you may need to change them, or you may want to change them if they do not fit your shape after a prolonged period of time. Cost of buttock implants. This is a question that probably is the most frequently asked questions to us. Sometimes patients don't even ask us as to how we're going to do it. Sometimes they don't ask us what implants we are going to use. So this is something that you need to know. Things that influence the cost in a buttock implant. One is the quality of an implant. So there are FDA and CE approved companies that we get implants from, whom we know are going to be manufacturing good quality implants that are of the latest technology, so that the chances of any complications happening are less. Also, these implants, as we discussed in our earlier video, they are different from your breast implants, and so they do cost a little higher, like 1.5 times to 2 times higher than what your breast implants cost. So one, the cost goes up because of that. Two, something that is very important that you have to always ask about is the procedure that is going to be done, whether it's going to be put inside the muscle, whether it's going to be put over the muscle. Where are the cuts going to be? What is going to be the post-operative care and the support that you're going to get from these surgeons? It's all of these things together actually decide the cost. Also, it decides one very important thing is where you're getting it done, whether it's a very safe place, whether it's something where you're comfortable with, whether you're going to have that personalized care. All of these things will also decide the cost. Because remember, this is most probably a one-time surgery for you in your life. Do not compromise on safety, do not compromise on results. The cost may vary between, may say 10 to 20% between different plastic surgeons, but again, get it done by a plastic surgeon. So that is also something that you need to do your due diligence on. Once you do all of that, see whatever cost that you're comfortable with, ask your surgeons. For us, if you want to ask us our cost range, you can go check out our website, drsaumilshah.com, and you'll find a complete price listing of all the surgeries that we do.